Hello, I'm Nathaniel Barnes. I'm a urologist at Memorial Hermann Medical Group in Houston, Texas. Diagnosing overactive bladder, or OAB, in men can be challenging. Many times when men are referred to me from primary care, they're being treated for benign prostatic hyperplasia, or BPH, but have residual symptoms like urgency and frequency. So in this video, I'm going to present my approach to the differential diagnosis of OAB versus BPH and briefly discuss OAB treatment. But first, let's test your knowledge. What do you think the answer is? If you said medical history, urinalysis, and physical exam, you are indeed correct. In my initial assessment, I obtain the patient's medical history and perform a physical examination and urinalysis to help rule out conditions like urinary tract infections. In my practice, I think it's also important to have patients start avoiding diarrhea and fill out a fluid intake form. It's critical to understand the patient's fluid intake, medications, and any comorbid conditions that may influence bladder symptoms. Here is another question for you. If you said urgency and frequency, again, you are correct. To get a better idea of the impact of bladder symptoms in men, I typically use the International Prostate Symptom Score, which looks at both storage and voiding-related symptoms. Although symptoms of OAB and BPH overlap quite a bit, I usually associate urinary urgency and frequency with OAB, while I associate hesitancy, straining, and weak stream with BPH. In men with symptoms suggestive of OAB, I typically obtain a post-void residual to rule out incomplete bladder emptying or urinary retention. And where there is any diagnostic uncertainty, I use urodynamics to rule out lower urinary tract pathology. Once I've diagnosed a man with OAB, we discuss possible treatment options. OAB is a preference-sensitive condition, so treatment is ultimately up to the patient. I first offer behavioral therapy to all patients with OAB. Next, I ask the patient if they want to take medication to help relieve their symptoms. If they say yes, we discuss the efficacy and safety of current pharmacotherapy options. For men with OAB and concomitant BPH, guidelines from the American Urological Association recommend either monotherapy treatment with a beta-3 agonist or muscarinic antagonist, or combination therapy with an alpha blocker. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of OAB with symptoms of urge urinary incontinence, or UUI, urgency, and urinary frequency in adults, and for the treatment of OAB with symptoms of UUI, urgency, and urinary frequency in adult males on pharmacological therapy for BPH. Gemtesa is contraindicated in patients with known hypersensitivity to vibegaron or any components of Gemtesa. Hypersensitivity reactions such as angioedema have occurred. Please see the full important safety information at the end of this video. Importantly, Gemtesa is the only beta-3 agonist approved for the treatment of OAB in men being pharmacologically treated for BPH. And Gemtesa is the only beta-3 agonist with efficacy data for all three key OAB symptoms in its label: urgency, frequency, and UUI. I consider Gemtesa for any patient, male or female, with OAB symptoms of urgency, frequency, or urge urinary incontinence. I also prefer Gemtesa in patients with cardiovascular risk factors because of its known safety profile. Note that in a 24-week study of OAB in men being treated for BPH, the incidence of hypertension was 9% with Gemtesa versus 8.3% with placebo. The most common adverse reactions reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Lastly, I choose Gemtesa for my patients with comorbidities who may be taking concomitant medications because Gemtesa does not interact with cytochrome P450 2D6 substrates. However, Note that concomitant use of Gemtesa increases digoxin maximal concentrations and systemic exposure, as assessed by area under the concentration time curve. Serum digoxin concentration should be monitored before initiating and during therapy with Gemtesa, and used for titration of the digoxin dose to obtain the desired clinical effect. Continue monitoring digoxin concentrations upon discontinuation of Gemtesa and adjust digoxin dose as needed. In summary, important tools to diagnose OAB in men include medical history, physical examination, urinalysis, and bladder assessments. Once a diagnosis is reached, it's up to the patient whether to proceed with treatment, and it's important to discuss the efficacy and safety of available treatment options with patients to help them make an informed decision. And remember that Gemtesa is the only beta-3 agonist approved for the treatment of OAB in men being pharmacologically treated for BPH.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to Vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.